Welcome to our explainer. Today, we're talking about activated charcoal. And I want you to just forget about the trendy black lattes and face masks for a second. We're going to dive into its real, life-saving role as an absolute powerhouse in emergency medicine.
I mean, you've seen it everywhere, right? It's pitched as this great detox ingredient, but its most critical and scientifically proven application is way more intense. It's actually a frontline treatment for certain types of poisoning and drug overdoses.
So here's what we're going to cover. We'll break down what activated charcoal actually is, how it works like a toxin magnet, when doctors reach for it, what its really important limits are, and we'll wrap up with some key facts you probably haven't heard.
Okay, first things first, what exactly are we talking about here? Well, in a medical setting, activated charcoal is a specially processed, super adsorbent material. And that one word, adsorbent, that's the key to everything.
Now you've got to pay close attention here. It's adsorbent with a D, not absorbent. It doesn't soak things up like a sponge. Instead, other molecules like toxins literally stick to its outer surface. So yeah, think of it less like a sponge and more like a magnet with this incredibly strong pull. And this is why it works so incredibly well. The activation process creates millions of tiny little pores, which gives it a gigantic surface area. We're talking the size of a football field packed into just a few grams of powder. That's a whole lot of real estate for toxins to get stuck to. So how does this toxin magnet actually work inside the body when things go wrong? Well, the process is actually pretty simple and incredibly effective. Here's the play-by-play. First, someone ingests a toxic substance. Then, if it's the right situation, medical pros give them activated charcoal. As that charcoal travels through the gut, the toxins get trapped on its huge surface. And finally, the charcoal, now carrying the poison, can't be absorbed by the body. The whole complex just passes safely out. And what's wild is how fast this all happens. The action is immediate. The second it hits the GI tract, it starts grabbing onto stuff. And it just keeps on working all the way through the system until it's either full of toxins or it exits the body. So, what is the actual clinical use case? It's a go-to tool for oral poisonings and medication overdoses. But, and this is a big but, it's a treatment where every single second counts. This is the crucial part, that 1 hour window. For activated charcoal to really do its job, it has to be given within about 60 minutes of the poison being swallowed. Any later than that, and the toxin might have already been absorbed into the bloodstream, where the charcoal just can't get to it. It is literally a race against the clock. Okay, now we get to what is maybe the most critical part of this whole story. Activated charcoal is a highly specific tool. It is not a magical cure-all, and using it in the wrong situation can be useless at best and dangerously harmful at worst. So on one side, yeah, it's great for lots of oral poisonings. But on the other side, you absolutely do not use it for corrosive things like drain cleaner, caustics, or petroleum products. It can also be really dangerous if a patient has an intestinal blockage or can't protect their own airway, because breathing it in is a serious risk. And it's so important to know it doesn't work on everything, not even close. It has zero effect on some really dangerous stuff like cyanide, heavy metals like iron, lead, and arsenic, or even some common drugs like lithium, aspirin, and phenobarbital. This is exactly why you never ever try to use this at home. Only a doctor can know if it's the right call. You know, like any real medical treatment, it's not without potential side effects. The most common things you'll see are nausea and vomiting. It can also cause constipation. These are all factors that the medical team has to weigh when they decide to use it. All right, let's get into some of the practical details and a few surprising facts about how this stuff is actually used. First off, the dose isn't just a one-size-fits-all kind of thing. It's carefully calculated by weight and by age. So an adult might get anywhere from 30 to 100 grams, but an infant, they'd get a much smaller dose, about 1 gram for every kilogram they weigh. It's a very precise, calculated intervention. Now, here's a surprising fact for you. Activated charcoal is actually considered safe to use during pregnancy. Why? Because it isn't absorbed into the bloodstream at all. It stays entirely within the gastrointestinal tract, so the risk to the fetus is basically zero. Just a couple of quick, memorable details for you. In the hospital, you'll often just hear it called AC. And a very well-known, totally harmless side effect is that it will temporarily turn a patient's stool black. And finally, because its whole job is to absorb other things, it has to be stored in a sealed container. If you leave it open, it'll start pulling moisture and other stuff right out of the air, which would make it way less effective when you actually need it. So, what's the big takeaway from all this? It's that activated charcoal is a powerful, fast-acting medical tool that saves lives in very specific emergencies. It is absolutely not a casual wellness supplement or something you should use for a daily detox.
Which kind of leaves us with one last question. Now that you know its real, intense, and time-sensitive clinical purpose, how does that change the way you look at a bottle of charcoal-infused juice or a detoxifying face mask on a store shelf? Something to think about. Thanks for joining us for this explainer.